Good afternoon.
Hi.
We begin with Michelle Smith from the AP. If Rhode Island reopens on Saturday as planned, will the state be adhering to the gating criteria set out by the White House Opening Up America plan for a Phase 1 reopening, such as the 14-day downward trajectories in cases? Why or why not?
Yeah, okay, thank you. Good question. So last Monday, I revealed the 6 factors that we would be taking into account in making a decision around whether we could enter, what we're calling Phase 1. The trajectory of cases and hospitalizations is one of those factors. Our stockpile of PPE is another factor. Testing capacity is another factor. Contact tracing is another factor. Ability to predict hotspots and have this sentinel testing, early warning testing system is another factor. Tomorrow at this event, I anticipate announcing that we'll be letting the stay-at-home order expire, and I'll be doing kind of a refresh of the various executive orders that I have had to sign, and we'll go through those factors, the 6 categories, and explain kind of where we are on each and why we have come to the decision that it will be a safe thing to go ahead and enter Phase 1. So that's how we're going to do it. It's in line with the guidance of the White House. Theirs was guidance. It was not, they didn't dictate to the states. They very clearly have said, make your own decisions, and we're in constant contact with Dr. Birx, and our approach is absolutely in line with what the CDC is recommending.
WPRO's Tara Granahan asks, as we approach Phase 1 and we can be around 10 people, what are your plans to allow reporters back in the room or outside on the State House lawn for follow-up questions? So
first of all, I don't know that it will be 10 people. It's more likely to be 5 people, and I'll be making those announcements tomorrow. And you should just work with my communication staff. I will do whatever you can work out with them to make sure that people of Rhode Island have the access that they need to what's going on in my office and in my administration.
Walt Buteau from Channel 12 asks, was there a better way to use the data that prompted the decision to build out the 3 overflow hospitals and the funding to build them now that it appears as though they will not be used? And any thoughts about ending the leases early?
Great question. I have not seen any data which suggests to me that they won't be used. So you have to remember, a couple of months ago when this started, we went to hospitals, every state in the country did, and said, essentially, stop doing your business, right? Like, stop doing elective surgery, stop doing non-critical procedures. Hopefully, I'll be making announcements, very soon, that starting next week, hospitals are going to be resuming, more of a business as usual, and therefore they're going to start to fill up again. It is absolutely not out of the question that we may need to be using some of these field hospitals. I don't know exactly when and how much, but it's, even if we don't have another surge, it is highly possible that we may decide, or hospitals may decide, that they need to or want to, for infection control reasons, use some of these field hospitals. So, or there may be another surge. I really hope not, but there may be. So at this point, the answer is, it's a good thing we have them. We're still trying to figure out when it would be safe to disband them, but I don't know anyone who thinks it would be safe to disband them now, or even for, a little while until we see how we do.
Brian Crandall of NBC 10 asks, has there been any improvement in containing the spread of the virus at nursing homes with the National Guard help and more testing? Also, will nursing home workers now be tested regularly?
Yeah, I'll answer that, and then maybe Nicole wants to say a few words. As I just said, our goal is by Monday to have tested every patient and every employee of every nursing home, and then to continue to do that on a cyclical basis. So we need to do it on a regular basis. Again, we want to try to stay ahead of any potential outbreaks in any communal living facility. So yes, Yes, the National Guard has done a terrific job helping with infection control, testing, cleaning. We've amped up our ability to provide PPE. So I would say yes, in answer to your question.
I'll add to that with saying our testing approach has been to make sure that all of the nursing homes have the tests offered to every resident and every staff. We've already been to 60 out of the 85 nursing homes and are going to continue going forward to doing that, offering it to all the residents and all the staff, covering the entire state, and then continuing to repeat that. That is one example of the full testing strategy that the governor shared. We want to have that approach with all of the areas that are highest risk, particularly our congregate settings, our group homes, and others, and we want to advance that work as well. It's the best approach that we have, and I understand that Rhode Island is among the more aggressive, as we've been saying we need to do. And then we want to continue to work with the nursing homes. It is challenging. Support them in the staffing stabilization, support them with the infection control needs that are there, and to support the residents, the families, and their second family, the staff who are there with them. So there's much more still for us to do, and we hope that it will continue to help us gain the control over that we want to and need to have.
Governor, the next question is from Ryan Belmore of What's Up Newport. Can you provide an update on restaurants being able to sell wine and beer to go? Will it be extended until restaurants can open again for indoor dining?
So the answer is yes, Ryan. And as you say, tomorrow I'm going to do a roundup of all the executive orders. If anything, we're going to look for ways to even expand that. We're looking for every way to help restaurants get through this. Some have asked for an ability to in addition to beer and wine, have some kind of mixed drinks as long as they have a cover on them. So I'm hoping we're going to be able to get there too.
Nancy Thomas of RI News Today says a few weeks back, Rhode Island estimated a third of those either sick with coronavirus or testing positive with coronavirus were healthcare workers. Today, New York reported that 66% of those admitted to a hospital had been at home and not frontline healthcare workers as expected. Can you clarify these statistics that she's provided?
We have an analysis of all of our cases, and for Rhode Island, we have that 20% of those who have tested positive for coronavirus are healthcare workers. The proportion of those who have been admitted to the hospital, I would need to collect additional data on and be able to share, but perhaps, Nancy, we can discuss further afterwards so we can get more information on what you wanted to know.
Next question is for you from Tanya Signori of the RI Echo. How many people that are currently hospitalized are from New York? Also, from the start of this, approximately how many people have been hospitalized here in Rhode Island that are from another state?
So we would need to get back to you in terms of the New York number. The way we usually handle it in general is if we have someone here who is hospitalized that's only visiting for a short period of time and is a resident in another state, we connect directly with the Department of Health in that state, and that state counts the resident as the case for that state. So the majority of the cases that we are sharing are folks who are truly Rhode Islanders. But with some additional analyses, we can get some more information about the smaller proportion of people who may be visiting from out of state.
Our next question is from Michael Bilo of Motif Magazine. Axio reports the Trump administration questions if COVID-19 deaths are overcounted because diagnosis by clinical observation rather than testing is allowed. Axio Ipsos poll last week found only 32% of the public nationally believe official counts. Will federal skepticism affect Rhode Island?
I hope not, because everyone in Rhode Island understands the tremendous amount of science and data that we have pulled together in Rhode Island to help inform our response. We have a tremendous leader in our governor and an amazing team across the state with the Rhode Island Department of Health, National Guard, Commerce, so many others who are working to be data-driven and to make sure that we provide the best information on the data that we have. So I'm not concerned about there being skepticism among Rhode Islanders because we're giving you the best that we have.
Thank you. Paul Parker of the Providence Journal asks, when the stay-at-home order is lifted, how will that apply to visitors from out of state or Rhode Islanders visiting friends and family out of state?
Yeah. So I'm just going to ask everyone to hang on one more day. Tomorrow I'm going to go through lifting the stay-at-home order, new order we'll put in place, and a whole refresh of the different executive orders. I will say this. This phase one is intended to be a toe in the water. You know, we're going ahead of Massachusetts and Connecticut. We have not started to see an actual decline in cases. So why am I saying that? It's not going to look very different than the way we're living now. If you're working from home now, you're going to continue to work from home. If travel is limited, it's going to continue to be limited. We might relax it somewhat, but not much. We can't get together in crowds now. We're not going to be able to get together in crowds then. So it will be better. We'll be able, you know, the hospitals. Remember, the focus I have now is getting people back to work. Healthcare folks, hospitals, like a third of the people out of work now are in the healthcare sector. We got to get folks back to work safely. Retail. And then we hope we get safely through phase one, have another 14 days or more of good results, and then we move into phase two. So I promise tomorrow I'll have great detail, but just to set expectations, it's not going to look very different than it does now, because we still want to go slow. We have to go slow and steady, frankly, because the risk of rushing is just too high.
Our next question is from Ian Donis of the Public's Radio. Why do people of color in Rhode Island have higher morbidity from COVID-19? How does this compare nationally?
So we are definitely seeing this nationally. Morbidity means why are we seeing challenges or side effects, complications of people who are hospitalized more or have negative outcomes connected to COVID-19. What this virus reveals to us is when you have the ability, economically, with good quality, and access to the resources that you need, you can effectively stay at home, follow the stay-at-home order, perhaps work from home, be limited in the types of groceries that you need to go out to get, and have the finances to support this approach for social distancing and community mitigation. If you live in a community where you are part of the critical infrastructure workforce and you're living paycheck to paycheck, your housing may not be of the best quality, the schools may not have had the ability to allow for remote distancing, that exposes those populations to more negative outcomes. Those living situations may also have predisposed someone to having other illnesses already in place. If you don't have access to fresh fruits and vegetables or transportation to be able to get to the pharmacy, to take the medications, or time off from your job to have sick leave if you needed it, then your diabetes might not have been as well controlled, or your asthma may not have been as well controlled as it needed to be. Those are the types of situations that set people up, in this case, for negative outcomes. That's why, as part of our response, we have to be very focused and targeted in addressing those underlying needs within those communities, because as this continues over the course of the next year, we need to make sure that communities have the quality schools that can do the adjustments needed to make sure the children are educated effectively, and access to the fresh fruits and vegetables, and have the economic job support that they need to continue to work or to work remotely. So that's what we are talking about when we address determinants of health in this situation, and COVID-19 has exposed the importance of doing that.
Thank you. Our last question, Governor, is from Parker Gavigan of WJAR. Approximately 280 of the state's 370 deaths are attributed to long-term care and assisted living facilities. That's 76%. Governor, what can you tell family members whose loved ones are dying and those residents who have tested positive and remain fearful about what's next?
So first let me say I'm sorry. I know how hard it is. As somebody whose mom is in her late 80s, not living in a nursing home, but is frail, you know, we worry too. It's a scary time. And I know this has been so brutal for folks who live in nursing homes, assisted living, and other communal settings. I want you to know it is getting better. As I said, by Monday we will have tested everyone. We now have the testing capacity to continue testing. We're getting better at handling this. The brutal reality, which I can't change, is that this particular virus has the most terrible effects on folks who are older and frail and already sick. And then when you add on top of that living in close quarters, it is really hard. It is a top priority of ours. We're going to protect every Rhode Islander. Every one of you is part of a family we care about. And I know you're fearful. I can't tell you, you know, I understand that. But we are so much better now than we were a couple months ago. Just the experience in our veterans home, for example, although difficult and painful, isn't nearly what has been seen in other states. That's because by the time we had a case there, our system was better off. So we're going to get better. It's going to get better and safer. More PPE, better staffing, more testing, and hopefully soon, you know, medicine and then a virus. And in the meantime, we're going to do the best we can.